The reality of urgent care looks like this: a full waiting room, ringing phones, and your most experienced front desk coordinator just gave notice. Your clinical team is highly skilled. Your patients receive excellent care. But somewhere between the patient walking through the door and the claim getting paid, the administrative operation leaks time, money, and staff every single day. Medical Group Management Association data confirms that front office staff, specifically medical assistants and receptionists, are the highest turnover hotspots in medical group practices. While retention conversations focus on nurses and physicians, administrative staff experience annual turnover rates between 30 and 40%. Replacing one employee costs up to 9 months of their annual salary, capital burned before they even handle a patient. This creates a predictable staffing spiral. One person leaves, the remaining team absorbs the gap. They become overwhelmed, and soon another resignation follows. This struggle to keep the front desk operational is a structural problem inherent to the urgent care staffing model, not a local management failure. When the administrative team operates short-staffed, the burden bypasses the front desk and falls directly onto the clinical team. Physicians end up absorbing the overflow, handling prior authorizations, insurance forms, and data entry that do not actually require a medical license. The American Medical Association reports that emergency medicine carries a massive 52.2% burnout rate, the highest of any specialty. Those physicians are spending an average of 7.3 hours per week strictly on non-clinical administrative tasks. Across the U.S. health system, this burnout costs an estimated $4.6 billion annually, driven by productivity losses, early retirement, and downstream clinical errors. Locally, the impact is immediate. When administrative tasks are delayed by overworked staff, urgent care practices leak between 20 and 35% of their total revenue. Empty administrative seats actively cannibalize your patient care capacity and drain recoverable income straight from the bottom line. Practice owners often remain trapped in this cycle because of a critical miscalculation regarding the true cost of an in-house hire. According to the Bureau of Labor Statistics, the average base salary for a medical administrative assistant sits roughly at $45,580. Using a typical $35,000 base, you must add $8,500 for benefits, $2,700 for taxes, $2,500 for training, $3,600 for space, and $2,800 for PTO. Factoring in $4,200 for turnover and $1,500 for management, the true cost skyrockets. The fully loaded annual cost to keep that single administrative seat filled is over $60,000. Clinics budget for a $45,000 role, but bleed over $60,000 in capital for a position that has a high probability of turning over within 12 months. Recognizing this structural flaw, an increasing number of urgent care practices are transitioning to specialized offshore virtual administrative teams. Staffingly leads this model, engineering an outsourced urgent care virtual assistant service specifically for the high-volume demands of mid-size practices. The primary operational hurdle in any transition is the complexity of navigating diverse electronic health record platforms, whether that is Epic, Cerner, Athena Health, or dozens of others. To solve this, Staffingly assigns a dedicated urgent care specialist who completes over 40 hours of orientation on your specific, localized workflows before they handle a single task. These specialists work directly inside the practice's existing EHR system, operating during the clinic's local business hours, regardless of geography. Practices can secure full-time equivalent coverage or scale down to a flexible hourly model for lighter operational needs. This operates as a seamless structural extension of your clinical team, completely removing the burden of local recruitment. The immediate question for practice managers is how an offshore team can maintain high-speed urgent care accuracy without triggering billing errors. Staffingly achieves this by supplementing its human workforce with an AI-powered automation layer that handles the most repetitive data components of urgent care administration. Natural language processing extracts key information from clinical documents, automatically pre-populating EHR fields to reduce manual data entry. A specialized duplicate detection system operates as an AI quality gate, catching redundant entries and errors before they turn into downstream billing denials. This technology is managed by strict human oversight. Every account is assigned a team leader for daily supervision, a process manager for quality compliance, and a dedicated customer success manager. Combining AI efficiency with rigorous human oversight allows the model to deliver enterprise-grade compliance at a scale in-house teams simply cannot replicate. When you measure the true cost of the legacy in-house model against the Staffingly architecture, the financial advantage becomes exact. A dedicated Staffingly virtual medical assistant costs a flat $21,600 per year. This encompasses the hidden burdens that destroy operating margins: benefits, payroll taxes, training, and backup staffing. This represents $39,200 in savings per position, a massive 64% cost reduction. For practices requiring lighter support, the flexible model scales down to highly efficient hourly rates, starting at just $12 an hour. This shifts front desk overhead from a volatile, escalating liability into a fixed, predictable operational advantage. A structural shift only works if it avoids operational downtime. Practices using Staffingly go live with this new model in just 48 to 72 hours. The deployment follows a strict 5-step framework: practice audit, EHR integration, team deployment, quality pilot, and finally, full production. The entire operation is protected by an enterprise-grade security stack, carrying full HIPAA, SOC 2 Type 2, ISO 27001, and HIT-RUST certifications. Adoption carries zero structural risk, as the model requires no long-term contracts. To prove the workflow, practices can test the integration through a 2-week risk-free pilot phase, fully backed by a 30-day satisfaction guarantee. Book a free, customized quote to see exactly how this integrates into your specific urgent care workflows. You can continue pouring resources into hiring your way out of a broken system, or you can build a smarter operating model that finally lets your physicians focus on patients.